What is a known disadvantage of deep hypothermia during cardiac surgery? A. Reduced myocardial preservation. B. Increased blood viscosity and impaired microcirculation. C. Enhanced coagulation. D. Increased metabolic rate. Answer: B. Increased blood viscosity and impaired microcirculation. Explanation: deep hypothermia increases blood viscosity, which can impair microcirculatory flow, a concern during both cooling and rewarming phases. Which of the following strategies is most important to prevent spinal cord injury during thoracoabdominal aortic aneurysm repair involving DHCA? A. Use of high-dose corticosteroids only. B. Trendelenburg positioning. C. CSF drainage and distal aortic perfusion. D. Rapid cooling below 15 degrees Celsius. Answer: C. CSF drainage and distal aortic perfusion. Explanation: protection of the spinal cord involves reducing intrathecal pressure, via CSF drainage, and maintaining distal perfusion, especially important when DHCA is used in extensive aortic repairs. In adult patients undergoing DHCA, which of the following has the strongest association with improved neurocognitive outcomes? A. Prolonged cooling time. B. Alpha-stat pH management. C. Hyperglycemia before arrest. D. Elevated hematocrit during rewarming. Correct answer: B. Alpha-stat pH management. Explanation: alpha-stat preserves cerebral autoregulation and enzyme function in adults, reducing neurological injury. It maintains physiologic intracellular pH and is preferred in adult patients. Which of the following would most likely prolong the safe duration of circulatory arrest during DHCA? A. Reducing pump flow before cooling. B. Maintaining systemic normothermia. C. Adding antegrade cerebral perfusion. D. Increasing PaCO2 levels. Correct answer: C. Adding antegrade cerebral perfusion. Explanation: selective antegrade cerebral perfusion, SACP, extends safe arrest times by providing continuous oxygen delivery to the brain during arrest, often used when greater than 30 minutes of arrest is needed. What is the typical target duration for safe circulatory arrest at 18 degrees Celsius without adjunct cerebral perfusion? A. 10 minutes. B. 20 minutes. C. 30 minutes. D. 60 minutes. Answer: C. 30 minutes. Explanation: at 18 degrees Celsius, cerebral metabolic rate is reduced enough to allow for approximately 30 minutes of safe circulatory arrest without additional perfusion strategies. 56. Which metabolic alteration is commonly seen during rewarming after DHCA? A. Respiratory alkalosis. B. Metabolic alkalosis. C. Mixed acidosis. D. Hyperkalemic metabolic acidosis. Answer: D. Hyperkalemic metabolic acidosis. Explanation: rewarming can lead to potassium shifts, tissue reperfusion, and lactic acid production, causing metabolic acidosis with hyperkalemia, which requires close management. Which of the following is the most sensitive indicator of impending cerebral ischemia during DHCA? A. Jugular venous oxygen saturation. B. Central venous pressure. C. Bispectral index, BIS. D. Near-infrared spectroscopy, NIRS. Answer: D. Near-infrared spectroscopy, NIRS. Explanation: NIRS detects changes in cerebral oxygenation in real time, making it the most sensitive and non-invasive tool for detecting early ischemia during DHCA. Which of the following hemodynamic goals is typically targeted during rewarming from DHCA to prevent cerebral injury? A. High mean arterial pressure, MAP greater than 90 mm of mercury. B. Normal volemia and controlled MAP, 60-80 mmHg. C. Hypotension, MAP less than 50 mm of mercury. D. Aggressive fluid removal. Answer: B. Normal volemia and controlled MAP, 60-80 mmHg. Explanation: maintaining controlled MAP and volume avoids cerebral hyperperfusion or hypoperfusion during the vulnerable rewarming phase, preserving neurologic function. Which patient population derives greater cerebral protection from pH stat management during DHCA? A. Adults over 70. B. Pediatric patients and neonates. C. Diabetic patients. D. Patients with prior stroke. Answer: B. Pediatric patients and neonates. Explanation: pH stat increases cerebral blood flow and ensures uniform cooling, making it especially protective in infants and neonates with immature autoregulation. Which statement is true regarding oxygen delivery during selective antegrade cerebral perfusion, SACP, in DHCA? A. Perfusion is typically through the femoral artery. B. Flow rates are based on body weight only. C. It allows targeted perfusion of one or both hemispheres. D. It increases risk of spinal cord ischemia. Answer: C. It allows targeted perfusion of one or both hemispheres. Explanation: SACP can be tailored to perfuse one or both carotid arteries, depending on surgical exposure and anatomy, ensuring more directed neuroprotection during arch repairs.